What is dry needling? Is it different from acupuncture? And how does it help us relieve our pain? Hi, this is Amin Ibrahimi, physical therapist, and I'm here today to talk about dry needling. Dry needling is a treatment that physical therapists use for pain and movement issues associated with myofascial trigger points. Myofascial trigger points are irritable spots located in the taut band of the skeletal muscles and can be palpable as a nodule. Sometimes the trigger point may be near the location of your pain, but they are also often the cause of referred pain. Referred pain is pain that originates in a part of body and affects another part of your body. This often emerges because of overuse, poor posture, or movement patterns. When your muscle is overused, it goes to an energy crisis where the muscle fibers aren't getting an adequate blood supply. When they don't get the normal blood supply, they don't get the oxygen and nutrients that allow your muscle to go back to its normal resting state. When this happens, the tissue near your trigger point becomes more acidic. Your nerves are sensitized, which makes the area sore and painful. Physical therapists use needle to alleviate your trigger points. When dry needling is applied to your muscles and tissues, it decreases tightness, increases blood flow, and reduces local or repeat pain. Providers use solid needles that don't contain any kind of medication. This is why the technique is called dry. Nothing is injected into your body. Stimulating a trigger point with a needle helps draw normal blood supply back to flush out the area and release tension. The prick sensation can also fire off nerve fibers that stimulate your brain to release endorphins, your body's homemade pain medication. Once your therapist locates a trigger point, they'll insert a needle through your skin directly into it. They might move the needle around a little to try to get what's called the local twitch response, a quick spasm of your muscle. This reaction can be a good sign that your muscle is reacting. The needles remain in your muscle for a short period of time. A very important thing about dry needling is that the needles allow a physical therapist to target tissues that they are not able to reach with their hands. You may experience increased muscle soreness after the treatment, but it's important to keep moving. This is normal and may last for 24 to 36 hours. Some people feel improvement in their pain and mobility almost immediately after a dry needling session. For others, it takes more than one session. The technique can also help with muscular issues that don't include trigger points. The needle creates a tiny lesion in the tissue, promoting blood flow and healing to the area. The effectiveness of this treatment depends greatly on the skills of the therapist to accurately palpate myofascial trigger points as well as kinesthetic awareness of the anatomical structures. The important thing about dry needling is that it's almost always used as a part of a larger pain management plan that could include exercise, stretching, massage, and other techniques. Dry needling and acupuncture. What's the difference? Dry needling is not acupuncture, which is based on traditional Chinese medicine performed by acupuncturists. Dry needling is a modern Western medicine which is supported by research. Dry needling is a newer treatment and evolved in the last few decades. It focuses exclusively on treating musculoskeletal and neuromuscular pain by releasing trigger points. Acupuncture restores energy flow, while dry needling targets dysfunctional muscle trigger points. This is the end of this video. Please avoid trying this technique if you haven't participated in the related courses to prevent any damage. Thank you for watching.